is Morning Crossfire on 99.3 Nigeria Info.
99.3 Nigeria Info. A very lovely, great morning to you wherever you are today. It's the last day of the year 2020, and it's been a very interesting year. Need I say more? I'm guessing that you already know how interesting the year's been different people with different stories concerning the year 2020. But whatever it is, we have to just move on. Congratulations to everyone that has made it thus far. So we have a couple of more hours to go into the new year. Let's do everything in moderation. Wear your mask. COVID is very, very real. It's right here with us. So you have to always put on your face mask wherever and whenever. Okay, and always as well, wash your hands regularly. All the COVID protocols, you know them too well, okay? So please do that. Welcome to the show. I'm Sheriff Quadry. We're streaming live right now on Facebook. Nigeria Info 99.3 is our Facebook page. You can watch live right now on Facebook. You can also join us on YouTube, Nigeria Info 99.3. We're streaming there live as well. You can watch and drop your comment, your COVID question. Drop it for us there on those two platforms. You can also track the conversation on Twitter at Nigeria Info FM. That's right, at Nigeria Info FM on Twitter. Feel free to also drop your thoughts with us on WhatsApp. The WhatsApp number is 0809 597 5805. Now, let's talk COVID-19. Second wave, what you should know. I'm not going to be doing the talking much this morning. I have the right person to do this with us. Country Director, United Nations Information Center, Roland Kayanja is joining us via the telephone. Mr. Roland, good morning to you.
Good morning, and good morning, listeners, and thank you for having me. Wishing a happy new year to all of you, and hoping that this year, 2021, will be better than 2020.
Fantastic. Now, Mr. Roland, let's start from the global scene. What do we know? What's the present situation concerning COVID globally right now? What do we know? I know, of course, that it's still ravaging across the world, but what are those important information that my listener can take with them this morning? Let's start from there.
So we have both bad news and good news. The bad news is that COVID-19 is still with us, coming to 9 months or more, actually, coming to a full year since it was detected. And ravaging countries, and many countries are experiencing a second and even some what they are calling the third wave. And also there is a new variant that is giving us sleepless nights because of its virulence. And also the fact that after lockdowns and all the interventions that governments had, the global economy has been battered and many people have lost jobs. It has actually exposed a lot of challenges with inequalities and poverty around the world. So That is the bad news, that this is still around with us. The good news is that we are getting, in fact, there are 3 vaccines we can now talk about that have been approved by various agencies in governments in the US and in the UK, which are promising. Yesterday we heard of that Oxford AstraZeneca vaccine, which can actually work very well in our environment. So it gives us hope, in a sense, light at the end of the tunnel, that if we continue using the non-pharmaceutical interventions, as you have been telling the listeners, it is hoped that in the coming months, as the vaccine gets rolled out, we will be able to contain this pandemic. But it's a bit a long way, we should say, but there is hope, and we should continue social distancing and other measures that we have right now. So there is the bad news, but we also have the good news that there is hope. And also the other thing is that many countries have thought of interventions to stimulate economies and make sure people get back on their feet in spite of what has been a very terrible year. So this is really the situation as of now.
Indeed. Now let's bring it back home here in Nigeria. Let's talk about handling of COVID in Nigeria. What's the United Nations stance on the handling of the situation by the local authorities?
First of all, we would like to thank the presidential task force that has worked hard with, of course, other agencies, the NCDC and all the other actors that have worked so hard to contain the COVID-19 challenge in Nigeria.
Right.
It is not easy for any country. It has not been easy for even some of the most richest countries of the world. So that has really gone quite well.
Right.
The challenge is that after the earlier lockdowns and of course the problems of the incomes of people and livelihoods, there was a bit of, I should say, especially in the public, people sort of gave up on the non-pharmaceutical interventions, the protocols.
Right.
And that has now brought a bigger challenge because now the spread of COVID-19 is for all of us to see. What we need to do right now is really to be more strict on the protocols, and I'm glad I'm seeing that even at state level they are taking it very seriously. The controls they are putting in, this is going to help. But what we need more now is risk communication to our people to know that COVID has not gone away.
Right.
It is still dangerous. It is still killing people. In fact, I think the main thing here now is communicating to people.
Right.
Because whatever you do, as the task force has been doing, if people are not caring about these protocols, we're still going to face this. So the main thing is all of us to make sure we save our lives and save other people's lives. Don't visit people if you really don't have to. Don't go in crowded places. Wear a face mask, wash hands, all these basic things that, in fact, Nigeria Info has done very well to talk about throughout the year.
Thank you.
You have talked about all these really like every day, but we just need to continue. We don't have to stop.
Now, let's talk about that.
On the side of the task force and the leaders, they are doing their part.
Right.
But I think on the community, that is where we need to do a bit more.
That's exactly where we're going now, the community level, the grassroots level. Mr. Rowland, there is a concern that I personally have. Anytime we talk about COVID on this channel, you can be rest assured that about 60-70% of reactions will be there is no COVID, it's a scam, they're using it to extort money from the international. Are you giving governments money, Mr. Rowland?
In fact, that is one of the challenges that we've got with COVID. It's not only in Nigeria, and I think it's partly because of the digital media. There is a lot of all kinds of misinformation about this COVID.
Right.
Many people saying it is a scam, it is a plot by all. In fact, in the beginning, you heard of the 5G.
Exactly.
All these things that people were speculating about.
Right.
But really, we are seeing our people dying. I mean, what other evidence do we need to see that there is COVID? And we don't want to see numbers of people dying going up. So, I know that there are all those misinformation, disinformation, and false information going around.
How do we convince people, Mr. Rowland? How do we convince them beyond reasonable doubt that, look, this is real? People are losing their lives. People have survived it. Even we had to bring survivors on this show and on other shows here on Nigeria Info to speak directly to the people, but yet we still get the same feedback from them. I mean, where do we go from here?
At the task force level, we have a team. We are working on the risk communication, and that is one of the questions we had. And we did a survey around Nigeria to see the levels. We found out actually that up to like 90% of the people surveyed all over the country, they know about COVID-19. They know about what to do to protect themselves. The challenge is doing what they know. That's where we found the problem. Okay, you know how to protect yourself. The person will tell you yes, physical distancing, face mask, and so on. Then you ask, do you do these things? He said, no, I don't put on a face mask. Why? Because I think where I am, I'm safe, and so on. You know, that kind of thing. But people are aware, and I think the next move for them to know that you are not safe anywhere. You can't say, okay, in the market here, it's okay. I've not heard of anyone having COVID, so I can lower my guard. So that is really the question you are asking, the question we've been asking ourselves. What more should we do? Because also we don't want to reach a situation when people are dying in such numbers that we really can't control.
Right.
Controlling this at this time, because Nigeria at least, okay, we know we look at many countries, even in Africa, but Nigeria is not really as badly off. But it can become if we are not careful. And that's why, as you see, rightly, the Presidential Task Force has given warning.
Right.
And that's why you hear them saying churches, do this, and so on, worship centers, be careful.
Right.
Very rightly so, because we don't want Nigeria. Have you heard what's happening in South Africa?
I know.
South Africa, it is terrible. They have reached 1 million cases and people are dying in numbers. So while we really sympathize with our colleagues and people in South Africa, we don't want that to come to Nigeria. And that's why people should understand all these measures. There is no hidden agenda. There is nothing like that. It is the crisis. If you don't believe, look at UK. Look at France, look at Brazil, look at the US. All these countries are struggling with this. So,
right.
Thank God Nigeria hasn't yet reached that level that we are all fearing. In fact, if you are talking about projections that we had for Nigeria, we thought by now it would be terrible. So thank God it hasn't reached that, but it is still very bad. And we think if people now take these measures seriously right now, it will help us not to reach those levels that we are seeing in other countries. So your question is really our challenge. What more should we do? We have talked, people know what to do, but really it is now at individual level for us to change our behavior. It is, as I said, you know when you are doing something and there is hope, it's sustainable a bit. You can say, okay, let me rest.
Exactly.
Maybe in 3 months, as the government is even saying, trying very much to bring in the vaccine, maybe within 3-4 months, the vaccine will be there and, then you can be more free to do what you want to do.
Right.
But really our cry, our call is please let us follow the protocols for now so that we save lives.
If you're just joining us, you're welcome. It's the Morning Crossfire on Nigeria Info, the nation's #1 talk station. I am Sheriff Quadry. Roland Kayanja, Country Director, United Nations Information Center, is joining us via the telephone, and we're discussing COVID-19 and what you should know. We're streaming live on Facebook and YouTube. Nigeria Info 99.3 is what you can watch live right now on Facebook and YouTube. Let's know what you think about our conversation this morning. It's to be very lovely to hear from you. We'll be taking your thoughts also right now this morning. 0700 993 993 993. That is 0700 993 993 993. And please, if you've got questions for my guests, go straight to the point. We would like to get in as many thoughts as possible, all right? But if you can't get in, just go to our Facebook and YouTube pages and drop your thoughts there. We'll get to them as soon as we can, okay? Let's speak with Bamidele Ajibola, who is joining us from Mushin. Bamidele, good morning to you.
Good morning, sir.
Morning.
Yes. I heard your man there. He has said it all about this COVID. But the problem we are having in this country is that our people need facts. We can't go on deceiving and giving deceive something. They want to see things. This is how it goes. Like in Mushin, Oshodi, and all the rest, these markets.
Yeah.
People there are not seeing what you people are saying over there because they know themselves all around. They know the next store man. They know the next store woman by them. And they have never seen any one of them dead. So and it is not easy for them to accept what people are saying. And to that one also, within the locality, it has never been seen. So within them, for instance, I live in Mushin here.
Okay.
I have been moving and have friends.
Okay.
Then I have people around, and we interact. And I have never seen all these things, people talking. And we know it's happening. I know it is happening. But there is one thing here again that is not. I am a natural man.
Okay.
I believe in prayer. And over there, look at what is happening. The governor contacted it.
Yeah.
That is a Lagos State governor.
Right.
Are you telling me that he did not take care of himself so much that he contacted it? People are saying it. Even those who are protecting themselves are contacting it. Then why don't we leave this? Because even when this thing was coming, nobody knew of it.
Right.
Even the so-called pastors and reverends, nobody knew of it. But if it is God, the poor people have led their condition into God's spiritual. That is why it is very bad for government to delay people from going into church to call on God to do something, or to go to the mosque to call on God. Who knows everything?
So, Bamidele, are you saying that it's God that is protecting the people? Is that what you're saying?
To us in Nigeria here,
it's God.
Okay.
He's
the one.
All right, Bamidele, thank you. Let's speak with Dennis very quickly. Dennis, hi. Good morning to you.
Good morning, Mr. Quadry.
Good morning to you.
How are you today?
Very well, Dennis. How are you?
I'm fine. Let me just ask your guest this morning.
Right.
If I thought he did listen to the lady that called from Ikoyi.
Go on.
The answer is no.
Go on. Yeah.
No.
Go on.
I want to ask your guest if he's aware that the society of today have lost interest, or they have no confidence in whatever projection the COVID is driving towards. Because if the authority does not adhere to simple instructions and rules, how do you expect a common man on the street to take to simple instruction? And again, why is it that the COVID is so prevalent in the city than in the rural areas? Because these people, they visit these people in the rural areas. And why is it so much pressure in the city than in the rural areas?
Okay. All right, Dennis. Thank you for your questions. Appreciate it. Mr. Roland, which would you want to attempt first?
The second one, I didn't hear properly, but maybe he said that it seems that some senior people are not following the...
Yes, he was talking about government officials, government themselves, not following the protocols they are telling people to follow.
Okay, yeah, that one, in fact, that is something for the the Presidential Task Force to also enforce. But as far as I know, is there are instructions about that, and that shouldn't actually stop. In fact, if you are aware, anyone who doesn't want to follow these protocols really brings on themselves a risk. And as you know, there are many people, in senior people that have died, as you've heard, of COVID. So no one is immune. There is nothing senior about anyone when it comes to this COVID-19. So yeah, it is true. Everybody has to follow the protocols. Now, the first one talked of, he raised an important point about, you see, a country like Nigeria has, there's an advantage also.
Okay.
Because majority of the people are young people. Young people tend to be asymptomatic. And actually, when they get symptoms of this disease, sometimes they are mild. So that's why he's saying, we've never seen anyone having COVID. Yes, they are likely to have been people with COVID around you.
Okay.
But just sometimes it doesn't affect the young people in the same way as people who have underlying conditions and people who are older, you may think it's not there. But every analysis has showed, especially in Lagos, that COVID-19, all over the country, but Lagos, it's very high. Right. So it is there. But yes, there is that advantage of youth, that you have the young people, but still we are seeing among young people, especially some of those who have underlying conditions, going down with this. So that should not in any way stop us from following the simple these tools we have. Just put on face mask. Be careful around you. Don't go into crowds and wash hands. They are small things. Okay, they can be like an inconvenience, but let's follow them. Because you never know when it will catch you and pull you down. It's a very dangerous and deadly disease.
Yes, it is.
That has killed many of our people.
Yes, it is, indeed. We're going to squeeze in one more call before we go on our first break. When we return, I have a question that I particularly want to ask you as to the forecast for the country in this second wave that we are in right now. It is ruthless. It is faster. It's spreading like wildfires in some countries. They're scared right now. They don't even know what New Year will be like for them. But let's quickly take in a call. Oladipo is here. Oladipo, good morning to you.
Good morning, Sheriff.
Good morning.
This is Pastor Oladipo calling from Orilegom.
Welcome.
As concerning this thing, I want to ask a question. This NIN, what happened to the old identity card? Is it still valid?
You're asking the wrong program right now.
No. There is a reason I'm asking, so that someone will not go and join the crowd again to prevent this thing. Because sometimes some people have the old one and they will still go and join this crowd. You know what I mean? So to avoid. Are you?
I'm with you. All right.
That's what I'm asking to know, so that it's part of prevention.
But that will be answered by NIMC. That's why I say you're asking the wrong program. Well, Mr. Robert, let's take some thoughts on Twitter because we're very close. If I ask you that question now, you won't be able to land before we go on our next break. Dolani Roberts on Twitter says, "Dear anti-maskers, knowing I have COVID-19 and I am sick, would you have a face-to-face conversation with me without masks? Wear your mask and stay safe." Dolani Roberts on Twitter put that across this morning. Let's take another one very, very quickly. Let's see if we can squeeze in one thought here on Facebook, because we're streaming live on Facebook as we speak. We are all aware that COVID-19 is real, but since our leaders don't maintain the safety protocols, that's why people don't believe there is COVID, because you have to practice what you preach to the people. Engineer Emo put that across this morning on Facebook. Mr. Roland, let's go on a break. After this break, we'll come back and talk about our fate when it comes to this COVID-19 second wave. It's very important we drill down on that and how we are approaching it as a nation here in Nigeria. I am Sheriff Quadry. Roland Kayanja from the United Nations is joining us via the telephone. Stay here on Nigeria Info. We're not done yet. After the break, we'll be back with more on this conversation.
Hey, Doredo, better itself. Now 10 gigabyte data just land my Airtel so. Guess how much? 3,000 naira. 3K for 10 gigabyte data. You shock, Abi? Make I add extra shock. 5,000 naira go give you 20 gigabyte data. Now so me for shock.
That's right. With Airtel Data.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk. 99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk. 99.3
Morning Crossfire. It's another show. I am Sheriff Quadry on a Thursday morning, the very last day of the year 2020, the very last edition of Morning Crossfire for the year 2020. Roland Kayanja, Country Director, United Nations Information Center, is joining us via the telephone this morning to discuss the issue that we all have been dealing with, that is COVID-19. Mr. Roland, a very lovely morning to you once again, and thank you for joining us.
Thank you for having me.
Now, let's continue with our conversation. We'll be taking the thoughts from our listener much later on, but let's quickly, because we have a lot to cover. Let's talk about second wave of COVID-19, what you have seen, how we have approached it. This and plus, of course, we have new strains that are pushing the second wave right now. First and foremost, everybody knows, it's no secret, that in Nigeria here, with over 200 million people, we are yet to test enough as we should. So that's one issue to start with. It's one big issue to start with. Now, the new strains are coming. That's another issue. Lack of treatment facilities and all, that's even bigger than, most of the issues that we have. What does the UN know exactly as to what lies ahead for Nigeria in terms of combating COVID-19? What can you tell us? I mean, don't tell us what you can't tell us that you know, but what is it that you can tell us?
In fact, you have mentioned some of the major challenges. So, according to the NCDC, Nigeria has more than 86,000 confirmed cases as of yesterday.
Right.
And this is a country of 200 million people. If you look at South Africa, it has now registered more than 1 million cases.
Right.
So there are two issues here. First of all, the testing. Yes, as you said, there need to be more testing. But in addition, actually, you see, COVID-19, it's difficult to hide. If you have it, even if you hide it, it will show, just like we've seen in countries like Brazil.
Right.
Burying people in mass every day. So there's no way you can say. So, yes, the testing is not adequate, but we also, there is no way we can say that it is already too much of a crisis, like what you have in South Africa. And that is really one of the reasons why Nigeria can be, you can call it an advantage, to avoid a crisis. And if we take all these small measures that we are talking about, and you're talking about a new variant, and everybody in the scientific community tells you what happens with these coronaviruses, they always mutate and change. The new variant spreads a bit faster, but it's not so different in terms of what we should do.
Right.
So the protocols remain the same, whether it's the old or the new variant that many countries are now experiencing. The protocols remain the same. While I would like to while we send this message, we don't want also to put panic into the hearts of people.
Exactly.
It's not that we are scaring everybody that everybody is going to die. That is not the point. In fact, one thing we should say is Nigeria has so far handled it well. But there's now a danger if we are complacent. Where there's complacence, then you can get the dangers that other countries have gone into. So that's why I think you are seeing what the Presidential Task Force is saying, and the NCDC is warning about January because of the movements of people, interactions, and so on. And the states now are putting in various measures to forestall what could become a crisis. Remember, health systems have had problems coping with this, even in developed societies.
Right.
How about in countries in Africa and including Nigeria? If we are not careful, the health system cannot afford to have thousands and thousands of cases of people going down with COVID-19. So the message really remains the same. Yes, Nigeria is having this challenge. It is not something that people should now be in panic about.
Right.
As long as we just take the simple protocols,
right,
we will be okay. You will be okay. You will protect your family. Don't visit You are a young person. Don't visit your grandma, your daddy who is above 60. For this time, please give him a call. Send him a text message. Protect the family. Because you may be young and you feel you are okay and so on. You don't know you are asymptomatic. And therefore, you are able to spread it to a person who is a bit more vulnerable. So we just need to take these they sound like simple precautions, but they will save a lot of lives. And in fact, save the country from incurring too much expenses because of this disease. The country has other challenges to deal with. And when we play our role as individuals, then we leave the country to deal with even other challenges that have come partly because, again, of this pandemic.
Let's talk about one of those challenges, which is the procurement of vaccines. Yeah. It's no news that if you look at our infrastructure here, the vaccines, actually, some of them, they take a lot to store, to transport, to administer. And you're looking at the structure here from the home front, and you're not seeing that much in place. And that calls to question the preparedness, the readiness of the local government, the Nigerian authorities here, in the preparation for receiving the vaccines, the COVID vaccines. Do you think we're ready for COVID vaccines?
Please don't forget that Nigeria is doing a great job in vaccinating. You know, when we talk vaccines are here already.
Yeah.
Nigeria has just received certification for polio eradication.
Very true.
There have been very clear campaigns of vaccination in Nigeria for the 5 killer diseases in children.
Right.
And Nigeria is doing well on that front. In fact, that's one of the areas that Nigeria did well with what we call the MDGs then. So the infrastructure is there from the local health units. But the point you are making about the nature of vaccines was the concern of everyone.
Exactly.
The good news yesterday was that the AstraZeneca vaccine can be stored like in a usual refrigerator one has at home.
Room temperature.
That should be easy to work with, and that's really the hope. And the UN is working with a number of other actors to ensure that vaccines are available to people in the developing world, including Nigeria. Because as you know, if you heard what, for instance, they were saying in the UK, the AstraZeneca vaccine, Oxford, the country, like the UK, understandably, because of the challenges they are going through, they have had to make a lot of massive production for their home country.
Right.
But the UN is fighting, working with a number of groups to ensure that the vaccine is available to countries like Nigeria. And Nigeria is also, there are already plans, as you heard the task force saying, there are already plans on how to make sure that the vaccine is available in Nigeria. The challenge was what you said about the vaccine, which was supposed to be kept at minus 80 degrees.
Right.
That would be a logistical nightmare, nearly impossible. But in terms of vaccines and vaccination, Nigeria is already doing a good job. It's not new in other vaccines. And if it is the Oxford AstraZeneca vaccine, it is similar to other vaccines that are on a routine basis given out to children in Nigeria. So that shouldn't be a problem. There is already a system of vaccination in Nigeria. So we just need to have the vaccine, first of all, available. And when it comes to Nigeria, I'm not really worried because it's not new for Nigeria.
You know, Mr. Roland, another thing that is making people, that is giving some stakeholders some concern, especially healthcare professionals, and I'm not sure that there's been an attention being paid to it right now. Yes, we're seeing the first side of it when people say they don't believe that there is COVID, or they don't do what they're supposed to do because they're not showing symptoms. I had conversations with about 2 or 3 health professionals who told me that the major concern that government is not really paying attention to at the moment is how to make people take the vaccine. So someone is not showing symptoms, is asymptomatic, and you're telling the person to come take the vaccine. I mean, they're seeing some kind of apathy towards taking the vaccine if eventually we get the vaccine. Is that a concern to the United Nations?
That is a big. You are pointing to a major concern because, as I said, this pandemic is the first one that has produced what we call an infodemic. It is another pandemic of false information, misinformation. So there is also this misinformation going out around vaccines, that there is, some hidden agenda and so on. So really that is one of the problems we are concerned about, that people start thinking, and it really explains to people. I see in other countries the extent to which they go to bring their officials to explain how this vaccine will work and that it is safe to take. We will have to explain to our people this. That's why I'm telling you that people should not think that vaccine is new. Probably most people in Nigeria have received the vaccine before.
Oh, yeah, of course. There are so many vaccines that have been administered to people.
Yeah, it's not a new thing. Yeah. It's so when we get all this misinformation that, there's a trick, somebody is, that is really a concern. And that is where we need to do a lot of communication around to tell people that please. And in fact, we need, of course, to work with all groups of people, whether it's traditional leaders and so on. In some countries, you've seen leaders themselves coming out to receive the vaccine. So
True.
Will feel that it's acceptable and so on. So these things, including the United Nations, the World Health Organization, will never be part of something that we think is sinister, of course. There are protocols in
Hello, Roland? Hello, are you there? We can't hear you. Are you there?
I agree with you.
Okay.
The challenge we have.
Oh, no, we're having bad connection right there. Roland, if you can hear me, we can't hear you anymore. We can't hear you. Hello, can you hear me? Okay. What we're going to do is we're going to try and call Roland back so we can have him conclude on that thought of his. If you're just joining us, you're welcome. Let me use the opportunity to take some of your thoughts that are pouring in. 8:45. I know the conversation is quite interesting, right? I was still going to ask Roland a question. Let's see. Okay, before we lost that call. Roland, are you here now?
Yes, I'm with you.
Fantastic. So let's have you land on your thought. We lost you at some point.
Okay. I was talking about the misinformation we are concerned about.
Okay.
In the UN about the vaccine. Because, remember, this started even before we are sure of any vaccine. There are all types of groups. But I want to tell people that probably every one of you listening to me has received a vaccine before. And probably that's why you can walk and you are not crippled.
Yeah.
And that's why we were able to eliminate many diseases that were disturbing people. Recently, we are thinking of eliminating polio. If you move around and you find people moving in wheelchairs, crippled, many of those, it is because of a small virus. The poliomyelitis. So we are able to deal with that. In the same way, people in many countries, I think what people like in our country, like in Nigeria or in parts of Africa, may not know.
Right.
On a routine basis, people in Europe and even in America take what they call influenza vaccines every winter.
The one we call common cold here that we just sneeze and we just walk away.
Cold here, you get it and you just, I don't know whether you take lemon and something like that. But for them, it is so severe in those places. So they, on a routine basis, they take vaccines. So vaccines are in many places as common as, like here in Nigeria, one would talk of a malaria, going to take a dose of malaria because that's what is more common in our environment. So once it is approved, that is the challenge we have. As you said, there are those who are skeptical because they are seeing some things on social media. Please trust that what will be approved will be to protect our people.
Right. Indeed. Mr. Roland, let's take some thoughts in. Oh, no, I'm tempted to ask you my next question, but I'm seeing people calling here. Okay, let me just ask you, and please, maybe the answer should be brief so we can take more thought. What is the fate of African countries? I know that the countries of origin of these vaccines, they need to go around there first and make sure that they get their own. But at what point are we expecting the vaccines here in Africa?
Oh, as soon as possible, because we have already, in the UN system, we have already made arrangements. Even before there is a coalition made headed by the WHO, even before a vaccine was approved anywhere, there were arrangements because everybody knew that the countries where the vaccines are really manufactured, they would want to help their systems first. So there is arrangements, and you should expect. What was slowing actually was approvals. But now we are getting approvals. Once that is done, I don't expect it to take very long because they are now already mechanisms for vaccines to reach here. For me, in fact, what was really a concern was the logistical nightmare of bringing the vaccine. There is hope now from the news we got yesterday of the Oxford AstraZeneca vaccine, which can do very well in Nigeria because you store it at room temperature. So it should be very soon. It is something that is a priority for us right now.
All right, fantastic. Ikechukwu is joining us now. Ikechukwu, good morning to you.
Good morning, sir.
Good morning to you.
I have a question for that gentleman there.
Okay.
Sir, I don't think that there is any pandemic and pandemic that is worse than this coronavirus. Now, he said that government have done theirs. I want to ask him, as government that have done theirs, why haven't they stopped UK flights? Why are they not wearing nose masks? Why are some of them are still doing party? Concerning NIN legislation, we are doubting that there is no COVID-19, and they are asking us to go and register and be spreading COVID-19 in registration of NIN. What are they doing? What is the United Nations doing for government telling us to go?
Hello, Ikechukwu. Okay.
What are they doing?
Thank you
very much.
Thank you too for calling me. Appreciate it. Roland, basically what Ikechukwu was saying, I don't know if you heard him.
No, I didn't hear what.
Yeah, it was basically just talking about the kind of back and forth in policies of government that is trying to tell people to observe COVID protocol, at the same time encouraging them to go cramp up somewhere to register for national identity number, and that alone is back this COVID. That's basically what he's saying.
Yeah. That's really for the authorities to look at. It is for everyone to see, but I think the national authorities need to deal with that.
Right, indeed. Let's take some comments here. Raphael Adegoke on YouTube says, can you tell us the difference between the COVID-19 in Europe and Africa, especially in Nigeria? Because the wave of COVID deaths in Europe is not as the same in Nigeria. That's a thought on YouTube. Roland.
I didn't get the question. That because there are not as many cases in Africa as in Nigeria. As in Europe.
Exactly. I was thinking that there may be a difference between the COVID in Europe and that in Africa.
Okay, it's not that there is a difference, but in fact there has been what we should say. I've been in many meetings and discussions around this because there was fear that the COVID pandemic would be as terrible as we are seeing, or probably worse than what we are seeing in Europe and in the US, which seems not to have happened yet, and we hope it doesn't. We are now getting a concern, for instance, with what we are seeing in South Africa, but we hope it doesn't. And there have been many explanations. First of all, the youth, the youthful population of Africa, and so on. So really, there is nothing concrete to say that why have many more people died in Spain and Italy than here. People are speculating a lot of things, and I wouldn't want to go into those speculations.
Indeed.
What I want to say is that it is true that somehow Africa has been spared so far what we all feared, and even even the Africa Centers for Disease Control was scared in the beginning. We were talking of big numbers. Yeah. It hasn't happened, luckily, for Africa. But we want now to continue to sustain it because if we see it hasn't happened, then we are starting at a good point because our health systems are weaker than in all those other countries. So this should give us motivation for us to continue at least using the protocols so that we don't get. Is that yes, in the beginning we thought Africa is not doing badly, but when we see what's happening, for instance, in South Africa, we are getting concerned, and that's why we are saying in Nigeria, please let's avoid that. Right. We have lost officially something like 1,200 people. Of course, every death is terrible. Right. But our calculation was showing that at this time it would have been way more than that. Right. So in a way, we are lucky. There are many factors. But we need to avoid it. This second wave could be devastating. So it is motivating. And in fact, as I said, we don't want to give a message of panic that we are going to be finished. And so that's not the point. The point is that probably we are at a good state, but we need to maintain this by following the protocol.
Thank you.
We don't want to go the other side.
Roland, thank you so much for joining us on the show today. It's been quite enlightening and an eye-opener, the discussion we've had with you. Hopefully we'll have you back here sometime very soon. Thank you so much for joining us on the Morning Crossfire.
Thank you very much, and I'm wishing all your listeners a wonderful 2021. Thank you.
You too. There you go, Lagos, Nigeria. Roland Kayanja, Country Director, United Nations Information Center here in Nigeria. And that's our show today. Happy New Year to you. That's what I'll be saying to you tomorrow morning when we talk again at 5 a.m. I am Sheriff Quadry. I'm online. You can chat me up definitely on Twitter at Sheriff Quadry, on Instagram at Sheriff Quadry, on LinkedIn at Sheriff Quadry. Have yourself a fantastic remaining what is left of 2020 and a beautiful 2021. Good morning to you.
Mama, me not want same money.